Good afternoon and welcome to our webinar. My name is Liz Kirkwood and I'm the Executive Director of Flow Water Advocates, a Great Lakes water law and policy center based in Traverse City. We are so glad you could join us today and learn more about one of Michigan's most pervasive water challenges, failing septic systems. We are joined today by an outstanding panel, including Senator Sam Singh, who recently introduced new legislation that would create a statewide septic code. Toward the end of the hour here today, we will answer audience questions, and you can submit a question at any time using the Q&A button at the bottom of your Zoom screen. Now I will turn it over to Skip and our panel, and thank you again for being here.
And thank you, Liz. Good afternoon, everybody. So, we are really gifted living in Michigan in the Great Lakes. We are surrounded by the world's most extraordinary, most magnificent freshwater system. The most of you are familiar with these numbers, but 21% of the entire world supply of fresh surface water surrounds us. 84% of all fresh surface water in North America, and more than 90% of all fresh surface water in the United States. Truly a magnificent natural endowment that we do appreciate. 2024 survey by the International Joint Commission found that 94% of the people who live in the Great Lakes Basin wants government to invest in protecting our waters. They're that important to our people. We also have 11,000 inland lakes and countless rivers and streams. But when we go out and test those rivers and streams, every time we look, we find an indication of microbial fecal human matter. And so that's why it's just astounding that Michigan is the only state of all 50 states that doesn't have a statewide septic code. And it's not for want of trying. We've been at this for almost 40 years trying to get legislation passed, and we haven't been able to do it while every other state, Mississippi, Arkansas, I'm not casting aspersions here, but they've all managed to do it, and we have not, despite living in this globally unique water paradise. So we're trying again, and we have, as Liz said, an outstanding panel here. We have Senate Floor Majority Leader Sam Singh, who is the author of a new comprehensive statewide septic code. He will be followed by Dan Thorell, who is the health officer for the Benzie-Leelanau District Health Department. We have Megan Tinsley, who is the water policy director at Michigan Environmental Council, and she will be framing the environmental risks and contextualizing the environmental issues associated with failing in substandard septic systems. And then finally, we have Anthony Kendall, who's at Michigan State University. He's the professor of Earth and Environmental Sciences, and he will speak to the scientific data that has been collected regarding the consequences of failing in substandard septic systems. So we're going to start with Senator Singh, who's going to give us an overview. Let me just say this, that Senator Singh put together this time a remarkable coalition comprised of local units of government, of public health professionals, of technical staff from EGLE, from the Department of Environment, Great Lakes, and Energy, from members of the septic industry who will do all the pumping and hauling and evaluation of septic systems, as well as others. So certainly the members of the environmental community. So with that, Senator Singh and our panelists will do a series of short presentations, and like Liz indicated, send in your questions because we'll have about 20 minutes, we hope, to answer your questions. Senator?
Well, thank you very much, Skip. It's a great privilege to be here today. I am going to go share in a few minutes a couple of slides that just sort of walk through Senate Bill 771, which is the new bill for a statewide septic code. I want to let people know that this process that sort of builds on multiple processes before that. And so I want to acknowledge that last session we had a series of work groups with the groups that Skip had mentioned, our local health departments, the environmental community, groups like the Michigan Municipal League, the Township Association, the Association of Counties, the septic system associations that represent the industry, the realtors, and a variety of other stakeholders. There was a series of those meetings. I was partnering at the time with Representative Phil Skaggs, and we came up with a number of good ideas and compromises over that period of time. Unfortunately for us, the session ended. If we had another week or two, I think we would have actually been able to pass the statewide septic code. But because of the time that we ran out, we are now having to reintroduce something in this session. We had a couple of gatherings last year. And I was pleased to introduce at the beginning of the year this legislation. And so we'll go through what is in here specifically, and then look forward to hearing from the other panelists and answer questions that people have. As Skip mentioned, with all of the fresh water that we have in our system here, making sure that we are protecting the Great Lakes, our inland lakes, our rivers and streams is a very important part of what is the responsibility of the state. What we see here is, I think we sometimes don't acknowledge the size and scope of the issue. There is over 1.3 million on-site septic systems throughout the state, and obviously the way we've been regulating it, since we don't have a statewide code, has been at the local level. And that ranges from, locals who just look at permitting of systems to groups in counties that actually do things beyond that, such as evaluations or have on-sale inspection opportunities and so forth. The goal of this legislation is to do a handful of things, and we'll walk through those pretty quickly. So first, the bill creates a technical advisory committee, and then this would help Eagle, the State Department that would be overseeing this, would help then create a set of rules that could be promulgated from this. We didn't want to necessarily have politicians sort of, putting things into legislation. We wanted to have experts and those that are really familiar with this issue to be the people taking a look at this, and we'll talk about the Technical Advisory Board. We wanted to ensure that locals who have sale inspections on sale ordinances, that those would continue, but that we wanted to ensure that they aligned with the new regulations, but we also wanted to ensure that transfers of properties still could continue. And then we'll walk through some of the timelines, but after the rules of promulgation, the 10-year period after the rules have been promulgated, we wanted to make sure that all of the systems that were in the most risk-based categories would have had a chance to be inspected, and we'll talk about what some of those criterias are. And then we wanted to ensure that based on a variety of reasons, whether it's financial, staffing costs, just not having enough capacity, that we also had the ability to provide some extensions for local public health groups to be able to meet these goals and objectives. So the Technical Advisory Committee, once and if this bill is passed and sent to the governor 120 days after the effective date of the act, the governor would have to call the first meeting of that Technical Advisory Committee. Within the 2 years of that act, the Technical Advisory Committee needs to make its initial recommendations to Eagle. We wanted to ensure that there was enough time to be able to do this appropriately. Within 3 years of that act, Eagle must promulgate the rules establishing the statewide septic code. Obviously, they'll be using a lot that comes out of that Technical Advisory Committee. And then within 180 days of those rules, all local health departments would have to create a plan on how to implement and administer these new regulations. And then after 120 days of those, Eagle would have a chance to review those and provide feedback to those. And so our goal is after that year of promulgation of those rules that we are beginning to implement these systems and plans that all of these health departments would create. The evaluation could start as early as 45 days after the rule promulgation. That would be the ones that are part of this evaluation process at the statewide level. Obviously, evaluations and inspections that were being done before under locals would continue to already be happening. Within 10 years of those rule promulgation, all of the items that are in what we consider risk-based categories would need to be inspected. This is not that they can wait 10 years to start these inspections, but we want to give them 10 years to go after the most egregious systems that we know that are most likely in a potential state of failure. And so those evaluations are based on that type of criteria. One of those criteria is the age of the system. We wanted to ensure that all systems that are 20 years and older but are within 500 feet of surface water need to be evaluated. If a system never received a construction permit, they need to be evaluated in that first group of evaluations, and that systems 30 years or older must be evaluated within that system. And so we feel that the feedback that we received, knowing that there's 1.3 million systems that have to be inspected, our local health departments, our counties, our townships, were very clear with us that they could not manage to do all of these without a significant uptick in evaluators who could go out and actually do the work, as well as have resources to be able to manage this. And so our focus in those first 10 years will be at those that are the highest risk of failure. After that, after a group has been evaluated, then we would expect that every one of those systems would be evaluated every 10 years. And then eventually over time, because of the age of every system will get inspected based on their age as they go forward. And so this was a compromise reached by a variety of groups because the question was, how do you get to manage this significant number of evaluations, since most counties are not doing any evaluations at this point in time. And so we will have some obviously debate on whether these are the right tenure and opportunities, but I want to just stress that within those 10 years, that first 10-year block, every single group that is in that high risk situation would be required to be evaluated by all counties throughout the state. We also create a public education and training fund. We want to ensure that citizens understand what the new requirements would be, how they should be thinking about this, wanting to make sure that we are helping our local health departments, evaluators, and so forth. So there would be a fee attached to that. The statewide program also allows local public health to charge fees. There would also be an administrative fee for the state, so the state could continue to manage this, and that there would be an online database. To me, one of the key things, and one of the early pieces of setting this system up, will be an online database. Currently, right now, most counties have not had the opportunity to digitize where their septic systems are in the county. In many instances, groups are still working off of paper copies. And for those that are maybe old establishments, there might not be any record that an older home that maybe is 60, 70 years old has a system, and we want to be able to ensure that there's an online database so everyone is aware where all the systems are in place. We have had studies that have shown that anywhere between 20 to 30% of septic systems are in some level of failure, and we want to ensure that that these evaluations are done in an appropriate way. We also want to expand a program that was started under Eagle, working with a group called Michigan Saves, which has been helping those individuals who have failing systems but might be of a lower income be able to manage their low-cost loans. We want to build off those low-cost loans, but also allow grants that could fully fund those changes and those repairs that would be necessary. And then lastly, there's a variety of other components here. This would allow for alternative systems to be having one set of standards. Those would be done at the state level. That would then be allowed to happen and used at the local level. There's a variety of other standards and guidance that would happen throughout this piece. And so just wanted to give you a few slides just to share with you sort of some of the thinking that has happened with this legislation. The key here really is an opportunity for us to bring in resources to our locals to be able to do this. One of the key opportunities here is that we also allow for third-party evaluators. A lot of our counties will not have the staffing capacity to be able to do all of the inspections in their county, and we want to be able to have third-party evaluators come in and to do those inspections. And so that is a key component of this as well. And so I'll stop here, allow my fellow panelists to go through more. I know we'll get into some additional details as questions come up, but that's basically a kind of high-level overview of what we're looking at in the statewide septic code. Thank you very much.
Thanks, Senator Singh. Appreciate that. And just also want to acknowledge the work that Senator Singh has done and Representative Phil Skaggs. A few years ago, they brought in all the partners to work, in an office at the same table and kind of go through the complexities of a statewide code. And there's many different facets to that. And that was the first time in my knowledge that has happened, and just very appreciative of the opportunity to inform decisions and help craft something that I think has made a lot of strides over the past few years, and something that is getting better and better as we continue to tweak it. So thank you. Just giving the local health perspective, the benefits of a statewide code. Just to give you a little background, there's 45 local health departments, including the city of Detroit. They don't have too many septic systems, but they have a few. And every one of those health departments have a different set of regulations, sanitary code, so to speak. And that has to do with the permitting and siting of new septic systems. And there's only a handful that actually do evaluations of existing septic systems. So a statewide code is something that local health departments have supported. The concept of a statewide code is just a matter of the details, right? Of getting something that we can all live with, and that is going to do what we need to do. I can give you the perspective of Benzie-Leelanau District Health Department. We've had a time of transfer program, or a time of sale, where when property sells or transfers, we've had this evaluation program in place since 1992 in Benzie County, believe it or not, and just 2023 for Leelanau County. In Benzie County, I would say that this concept is slow and steady wins the race. Over time, it has huge benefits. Right now, looking at 2025 numbers, we've only have a 5% non-conforming system rate for the properties that are looked at in Benzie County. Now, Leelanau County is a little bit different story because it was just started. It has about a 15% non-conforming system rate, and that's to be expected. That's where it started in Benzie County, and then over time, that number has gone way down. So, can you imagine, if we had been doing this statewide, for the past 25 or 30 years, we would be in a lot better shape. So, I have to give my my predecessors a lot of credit in getting this going where I currently work. So, I think it's a great program. It's effective. I will say from a time of transfer standpoint, People expect inspections to take place when a property transfers. There's money on the table during that transfer, and there's negotiations that happen. So, I mean, this is just something that it works, right? And we don't prevent transfers either. I mean, if a property is transferring and there's issues that come up, there's a mechanism for placing money in escrow to take care of those, so the transfer can go through, but things are addressed. And I really appreciate the fact that those type of property time and transfer programs are still in the statewide code as written right now. Some of the things, the aspects of the statewide code that are very important to local public health is the database. That is huge. I mean, it is very fragmented, as you can imagine, throughout all the local health departments throughout the state. Some only have paper records. We at Benzie-Leelanau we have digitized our records, and it's in a format where you can actually go in and search a property and find the record, but you can't query, you can't put in, I want to see all the septic systems that are over 20 years old. That doesn't exist, right? You can search by property and address and actually physically look at it. There's a lot of work that would go into populating a database, but we have to start. We have to start somewhere, right? The fact that we're doing risk-based inspections to begin with is huge. I mean, when I think about the biggest impact, and this comes from many years of experience of working in the field, doing septic system permits and seeing these things firsthand, where the most impact is near water, near surface water, and for those systems that are old and the ones that we've never even set foot on the property. I mean, and 99.99% of the time they are not appropriate, not sized appropriate, even if they're in good soils, right? The fact that we will have a technical advisory committee that is comprised of local health department membership throughout the entire state, representing the UP and Northern Michigan and Southeast and Southwest parts of the state, because our geology is variable. It differs greatly. And to have all that input from those individuals at the local health department standpoint. There's other engineers and hydrogeologists and environmental groups and industry groups that are part of the septic pumping and evaluation, private inspectors, if you will be part of that as well. So I think that's huge. Having an alternative treatment system evaluation and approval program through the state, because again, this is another thing that is fragmented throughout the state. Everybody's doing something different. Where you can use an alternative or innovative technology in one part of the state, you can't use it in another part of the state. So it's, by jurisdiction, and to have something that is statewide that, has a system of approving those and giving guidance to local health departments would be a huge step forward. The financial assistance piece is something that is a really big deal too, because as we work through this and we're doing these evaluations and we identify more systems that are failing and need to be addressed, I mean, some of the price tags on these can be really quite large, especially as you get into complex systems. If we're near water or in a high water table area that the system has to be built above ground, basically, or maybe using some alternative technology, it can get pretty expensive, $30,000-$40,000. So to have that available is something that is a key component of this. Where I say that we need more work is funding for local health departments to do this. In the recent Senate fiscal analysis, it was about $6.3 million that would be allocated towards local health departments. And if we divided that equally, it would be about $137,000 per health department, which isn't a lot of money. And actually, it wouldn't be divided equally either. It would be, I'm sure health departments that had more septic systems would, get a little bit more, and then it would be, a different amount for ones that have less. But you can't really do much of that. I mean, of course, we'll be able to charge fees, but we want to keep it, reasonable for homeowners and whatnot. Another aspect that we really need to kind of flush out too is enforcement. As you can imagine, we could have, and this is more so after COVID, individuals not liking the fact that we're forcing them to do an evaluation and perhaps do a huge upgrade where they don't actually see a problem. And I think there's going to be a huge amount of education that's going to need to be done, and also buy-in from our local prosecuting attorneys, so we can do adequate enforcement. I've heard some talk about the 10-year time period as far as getting the risk-based evaluations done, and some criticism there. I will say that to me, it's reasonable, and the only way I can explain this is just giving you an example. In our jurisdiction at Benzie-Leelanau, we have about I've done some analysis, and I figured we have about 10,000 systems that would meet that criteria. Now, this is just an estimate. So if I'm doing that within 10 years, I'm doing 1,000 per year, right? And to give you a little bit of perspective, right now in our time of transfer program, we're doing about 700 per year. So it would more than double what we would need to evaluate. So I would have to hire probably at least 4 full-time individuals to get that done. And again, like doing 1,000 per year, it's giving me and that seems a little bit more reasonable as far as getting the resources to do that. Now, that's if I'm doing it in-house. If I can hire, or potentially do a program where we have private inspectors, I mean, that could help there as well. But again, we need to get that ramped up, because in our area, we will not have enough private evaluators to do that, at least right now. And I am confident that the market will take care of that problem. But and just, to give you an idea too, we have a very comprehensive, in the statewide code bill, a very comprehensive evaluation program, meaning, you're going on site, you're digging holes into the drain field and looking at the stone. You are exposing the septic tank, you're getting the lids off, looking in the tank, you're determining whether or not there's illicit connections going to the field. And if you are at places where we've never been before, it is a very time-consuming and difficult process to determine all those things, because you have nothing to go off of. It takes, on average, about 5 hours to complete a comprehensive evaluation like that. And that is considering the drive time and, doing the report and everything. And that's an average. Okay. So that kind of gives you an idea. I hear, sometimes we're often compared to other Great Lakes states where they have evaluation programs, but we have to be careful not to make that comparison, between apples and oranges, because I can tell you, for instance, in Ohio, they do a very cursory evaluation where the inspector just basically walks over the field and checks a box, that says whether or not there's sewage ponded or not. They don't dig into the field. They don't spend time to, expose the tank or look at the inside the tank or anything like that. And, on average, they can do anywhere between 15 and 20 evaluations per day doing that. So we have to be really careful. I think the type of evaluations that are going to be part of the statewide code effort are much, much more comprehensive and much better, right? We're actually going to, address things and determine things that you would never see if you were not digging into the field or, exposing the tank. So that's really the information I wanted to share from the local health department standpoint. Again, very supportive of the statewide code effort and concept, and just, again, saying that we need to really work on the funding and enforcement aspects of how we're going to actually implement this. So I appreciate that. And I believe next up is Megan.
Yeah, thank you, Dan. We appreciate those insights. Megan Tinsley will now take over. Thanks, Megan.
So as my slides kind of get queued up here, we've all seen the news articles about Michigan lacking a statewide septic code and what that means for our environment and public health. I'd like to spend just a few minutes expanding on that a bit. And you can, there we go. And so if too many nutrients go into the water, so nutrients can come from, it could be from commercial fertilizers spread on row crops, could be land spreading biosolids, failing septics, animal waste spread across the landscape. There's a lot of sources of nutrients. And when too much of those overload our water, we end up with those unsightly green algal blooms. And we know they close beaches, but they also do have an environmental impact. They change the ecosystem because it basically, the algae sucks and uses up all the oxygen in the water column. And so you're left with areas that fish and other aquatic life just can't live. So we're changing the ecosystem, but we're also threatening public health because some of these algae become toxic and they are classified as a cyanobacteria, and they release these toxins that are actually classified as liver toxins. So they can certainly harm pets that are near the water shore, but they're also dangerous to people. So boat action can stir up the water and actually send the toxins to be airborne. And there's researchers at the University of Toledo that have done work to show that people with certain pre-existing illnesses are actually more vulnerable to the health impacts from the toxic algal blooms. And next slide, we do know that the extent of the blooms and also where areas where we have over sort of out of compliance with water quality standards. This map is already a few years old, but you can see the yellow areas are reflecting areas that are monitored by Eagle for E. coli. So E. coli is a bacteria that lives in the intestinal tract of all mammals, including humans. And so those areas in yellow are out of compliance for what we call total body contact. And that means basically whether a river or stream is safe for human contact without someone getting sick. So we know we have extensive E. coli contamination in the state, so much so that it didn't make sense to do water quality plans for individual lakes and rivers. Eagle developed a statewide approach because we know that the contamination, the level is quite widespread. And it's important to note, I'm not saying the source of this is entirely failing septics. There are all those other sources that I mentioned, but we know because of the high failure rate that's been documented that septics are a contributing factor. So we have 9,000 miles that we know of for sure are out of compliance. And as more monitoring comes online, we expect that to grow to 37,000 or half of Michigan streams being out of compliance for swimming, and which is pretty astounding. And next slide. So there are instances where septic tank density has been linked to human health implications. So there was a study done in a rural area of Wisconsin, and it found that children that were reporting to a health clinic, it was a very, unpopulated area. So all of the children in this community went to one health clinic, and they were able to detect these patterns of diarrhea. And they were able to attribute 20% of the viral diarrhea. So, human waste contains viruses, and then also bacteria. So 19% of the bacteria diarrhea cases were correlated with the septic tank density in this particular area. And so you might be thinking, but wait a minute, I thought Michigan was the only state without a code, which is true. Wisconsin, their approach to septics is to do mandatory pump outs every few years. So they are typically removing waste from septic systems. As Dan mentioned, their methods for inspection are not nearly as comprehensive as what this legislation introduces. But these particular systems were a special type where I believe the waste was held much longer. But in any case, we do have evidence that human illness has been associated to septic tank density, and the recommendation in the paper was that we need to have standards to protect public health. So this is why in the environmental community, all through the stakeholder process that Senator Singh mentioned, the environmental community has been coming together ourselves to sort of talk about what are the most important things from an environmental perspective that the legislation address. And first and foremost, we are definitely advocating for the statewide and not a local approach. So some counties and areas like Dan's have been doing these time of sale programs, which in those areas have contributed a great deal to preventing water quality pollution. But in some areas, like the Barry Eaton District Health Department, they were running a similar time of sale transfer program for 10 years that identified a startling level of failure. So 27% of some sort of corrective action being required for a system. And then also they tested wells at the same time. So they found coliform, so the E. coli bacterials, and also they found nitrates in over 100 wells. Nitrates would be stemming from the nutrient pollution, and that is particularly dangerous for pregnant women and young children. And shockingly, this program, after discovering all this failure and noticing all these things, including, direct discharge to water bodies or farm fields, even raw sewage observed on the ground surface, and a child living in that home that was particularly sick. Even after all of that evidence, that program was repealed. And this is why we really want to, see the need for a statewide approach. And then, moving into one of the key, fundamental things for the environmental community is that we move to a periodic approach to inspections. So the bill calls for that currently. Once we get through the high-risk systems that the senator mentioned, the older systems, eventually, after a very, very slow, ramp-up time, we would get to the point where we would be inspecting all in systems at some point. And that is really the key to moving away from this out of sight, out of mind approach that has landed Michigan. One of the reasons we're in the position that we are right now. There are many homeowners, and Eagle included this in their E. coli report. Once a system is installed, it may not be inspected again. And that's why one of the reasons we have this tremendous amount of failure. So the periodic approach would move us to that becoming a routine maintenance for a home that is using a septic system to handle its wastewater. And we do have, some documentation for a lack of public awareness. This is just a few points from a public sector consultant study that surveyed some residents around mid-Michigan and Saginaw, I believe, and approximately 30% of them didn't know they had a system, and 43% indicated they had not had their system pumped within the last 5 years. So EPA recommendations are a system inspection about every 3 to make sure, to determine whether you need to pump, if the system's full, if it's functioning. And so we have a high percentage of residents utilizing this for their waste disposal, but they're not informed about what they need to be doing to maintain the system. And finally, again, the time of sale programs have been impactful for where they've been in place, but it's only happened in 12 out of 83 counties in the state. And Michigan is actually 11th in the nation for homeowners staying in one place for a very long time. So we have homes that just stay in families, and therefore the time of sale would not be triggered for their systems because it just hasn't been up for a transaction. And finally, I'll just mention that this trend of people staying in their homes has really increased. So over time, people, and especially you see that bump during the COVID years. So homeowners are staying in their homes twice as long as they did 20 years ago. And that, Michigan probably following that trend. It's one reason we feel like for this legislation, it's so important to move us to having inspections on a regular interval. And with that, I will turn it over, back to Skip.
Thank you, Megan. With regard to homes and cottages, one would think that they disproportionately are passed down through family, and so, have less opportunity to be inspected, but under the legislation, they become a priority. So that's great. Anthony, take it from here.
Thank you, Skip. And thanks, everyone, for really framing this problem really well. I just want to say I am a lifelong Michigan resident, and I've been an MSU Spartan ever since I was born. I came to MSU in 1999, and I've been studying water quality and quantity in ground and surface waters ever since. So properly maintained and installed and designed septic systems do a really good job in removing pathogens. And the primary means of doing this is through other microbes, friendly microbes in those tanks, and then in the drain field that the water leaves the septic tank and then percolates through the soil. Those systems also do a really good job in retaining phosphorus in many settings. Not everywhere, and it depends on the design. And so we need flexible rules that accommodate Michigan's varying geography. But a lot of our nitrogen still gets through. So those nutrients aren't completely taken care of. And so this is an important first step in addressing some of the nutrient problems we're having in our stream, or a very important step. But there will still continue to be work to do. So we need to keep our eye on that ball. As the water percolates down through our soil beneath the septic system, it eventually reaches the groundwater table, and there it's transported to Michigan's surface waters, our lakes, our rivers, our streams, our Great Lakes. And that's really where the health risks begin for most of us. So as Skip mentioned earlier, our research that ours and other research shows that we have human fecal pathogen in most of the streams in levels that exceed what are expected for treated wastewater. So this means that there has to be a source of fecal contamination outside of wastewater that is driving these levels up. And we've done research on this for quite some time. And what we found is that the single most important factor that we could find that controls how high those concentrations are the number of septic systems upstream in the watershed of those sampling locations. So those septic systems, as I mentioned, they're really effective at removing pathogens. So we don't believe that it's the septic systems themselves, but rather the failing septics, or potentially the illicit connections that are associated with areas with a lot of septic systems. But what challenged our research, and I'll just kind of move it into some interesting graphics and data to get your attention here. So Megan, could you pop up that slide that I had sent you? So to do this research, we actually had to make educated guesses about where those septic systems were, because there is no comprehensive statewide database on where the systems are. This slide shows a map of all of the water wells that have been installed in the state of Michigan since 1996, and many of those installed prior to 1996 in a system that's called well logic. Since the 1960s, well drillers have been required to record information about each well and then submit it to either the local or state regulating bodies. And these data are publicly available. I downloaded this data yesterday afternoon, and within about an hour, I was able to make a graphic that shows where on the map every one of those 1.1 million water wells are located, but I could query that by year and show how many new wells are installed. There's really interesting trends and insights in those data. I could query it by county and say how many are in each county. That shows that one of the interesting patterns we see in these data are that wells are concentrated not in rural areas, but rather in the suburbs and the exurbs of our larger municipal regions. And with most of these these wells, there is an associated septic system. We just don't know where it is. And so by the same insight, septics aren't just a rural issue. There, as Megan noted earlier, there's been studies that attribute health issues in rural areas, but most of our time spent in streams, most of our recreation, most of our water use occurs in and around large population centers, and that's exactly where these septic systems are themselves concentrated. So I'm just making a pitch here. In addition to the basic science that supports the need for this, we really do need a database that tracks these, that will help not just scientists understand the problem, but will help local and state resource managers really get a hold of the overall scope and better manage our water resources.
Anthony, we have a couple of questions from the audience about the actual mechanism that is operative here that results in contamination of surface water. Is it groundwater that migrates to surface water, or is it runoff from surface runoff from failing septic systems?
You can get both. As a couple pictures that Megan had showed there, you can get contaminated water sitting on the surface that then can run off in intense storm events. But primarily, it's migration of those waters through the groundwater system that brings along those nutrients. Um, a lot, though, of the failing systems, they have shorter paths. They tend to be concentrated around our lakes and rivers. And so that groundwater flow path might not be very long. It might just be 50 or 100 feet between where that septic system is installed and the nearby receiving stream or lake.
Thank you. Thank you. Dan, we have a couple of questions of what constitutes a failure. Can you talk about that a bit? And also, I know that the statute drafted by Senator Singh allows for minor repairs. So, if you could distinguish what might require a minor repair as opposed to a huge, complete failure of a
Sure,
system.
sure. Well, I mean, the big state definition basically of a failure is when there's sewage on the ground, you have an illicit pipe going out to like a ditch or a stream or surface water, or it's backing up into the house. And so that's a catastrophic failure. Now, in other sense, there's other non-conforming issues that can contribute to a failure that is included in the statewide code legislation. And it could be things as such as like the septic system is too close to groundwater. If you're only a few inches from groundwater, the bottom of the field, or actually in groundwater, you're not actually treating the wastewater. It's going into the groundwater. There is no opportunity for treatment. So that, in my mind, is a failure. And then also, there can be other things too, like the system is undersized, right? So let's say you have a system that was sized for a 3-bedroom house, and over time bedrooms got added and additions came on and whatnot, and all of a sudden you got a 5 or 6-bedroom house that's all the wastewater is going into a system that's not sized appropriately. So you're really kind of flooding that system and not giving the aerobic bacteria in the soil a chance to treat it, to remove those pathogens, to remove those nutrients. So there's things like that. A minor repair, to answer that question, could be simply, let's say the pipe from the septic tank to the field somehow got crushed, and there's a blockage there of some sort. So that could easily be dug up and a short section of pipe be replaced. That could be a minor repair that, maybe the field is sited properly, it's adequately sized, but that's the only issue, right? So, and that could be something that's discovered in an evaluation, or in the septic tank. Let's say there's a baffle where the pipe sticks down into the tank to the middle third of the tank to draw out the clear water, so to speak. Between the sludge and what's floating, the mat on top that's floating, and draws the water from there to go to the drain field. If that baffle's missing, you could be prematurely, ending the life of your drain field, because all the scum is basically going into the pipe and getting into the field and plugging up the holes. So that's the examples that I have there. Hopefully that answers your question.
Thank you. Senator Singh, will this database that everyone seems to agree is critically important, will it be publicly accessible, and are there privacy concerns associated with these data?
I think one of the things is we attempted to get it funded in last year's budget. Unfortunately, it did not happen there. We'll continue to try to fight for the funding of that. I think even if somehow we don't get a code done this year and we have to wait another year, doing the database now is a top priority, I think, for all of our stakeholders. The question really is, how do you get the cost? Because there's a cost, obviously, not only to the state to help develop it, but then there's a cost to the locals to be able to, infuse the data and their systems into that statewide database. We've been having conversations on how you protect, some of the basics information of people, but we also have been debating on, whether or not there should be an openness to understand that, hey, there is a failing system, in your community that is your next door neighbor or whatnot, right? You want to be able to have that. And so I know it is a continued debate as the legislation will go through on, how much of it should be available publicly. At the same time, are there certain indicators that we can protect? Perhaps the name of the individual, but just talk about the address and things like that. So I think that's still being debated at the stakeholder level, but we want to make sure that there's at least enough public understanding that if there is a crisis or an issue, people would be well aware of it.
Thank you. So here's an interesting question. Are septic systems, if properly maintained, do they last forever, or do soils become inevitably oversaturated? Whoever
I
wants
can
to take.
answer, I can answer that one, Skip. No, they don't last forever. I always, when I talk to people about their septic system, and because lots of times people, it's out of sight, out of mind. It's amazing how many people don't even realize they have a septic system. So what I compare it to is the roof of a home, and the difference is that every day, you see your roof, you drive up, you can see your roof, you see it degrade over time, and you mentally prepare yourself, right? Like, oh, I need to replace that roof in 5 years. I did that back, 15 years ago. I got maybe 5 to 7, 8 more years left on that, and it's in your face, right? So for a septic system that it's kind of out of sight, out of mind for a lot of folks, it has a similar lifespan as a roof. And, if you take care of it, I mean, of course, there's, it's a bell curve, right? I mean, you have exceptions on both ends. You can have ones that fail really quickly if they're not taken care of properly or get really overloaded, or you have the ones on the other end that last a very, very long time because of their use. Maybe their seasonal use, and they have adequate time to kind of digest the nutrients and taken care of very well. The tank's pumped out every couple of years. But for most of us, at least in our area, and it varies by area too, because in Northwest Michigan, we're, at about 25 to 30 years as an average life of a septic system. But I've worked in other parts of the state where you have heavier soils, clay, more clay content in the soils, and those systems don't last as long. They last maybe 10 years less. So that's, my input on that.
Yeah, thank you. Senator Singh, we have a question from the audience. Why has this taken so long? What have been the major impediments in the past to successfully enacting this legislation?
Yeah, I would say that the cost of what is a failure has been the biggest issue that people grapple with. Out of sight, out of mind, I think is, how some people want to view this issue. And they know once you have a statewide septic code, there's evaluations that are being done that, your residents are going to find out, hey, I've got a failing system. And guess what? Now I've got a $15,000 bill, $10,000 bill, some even higher if you've got even a larger septic system. And so I think that has been the biggest issue. And how do you manage that? And so I think you've had at times realtors and other groups who are worried about the transfer of property. You've got health departments and local governments who don't have the capacity and they need the financial, support to be able to do this. And so those have been the issues. I mentioned in my testimony in front of the Senate committee, I first got involved in this issue in 2018 when it was being discussed. And that reiteration of it, but that has been the basic conversation for the last 40 years is, how do you manage that? And that's sort of why the push has been to let the locals try to figure it out. But again, I think after hearing this, I hope people understand, and I'm sure a lot of the people here already agree with that sense that we have to get to a statewide level. But the issue is really about costs and how do we manage some of those pieces.
Yeah, yet other states have somehow managed to do this while we have not been able to. So here's a question for Megan or Anthony, I think. Interesting question. Will this new code also apply to pit toilet systems like in many remote state parks and in UP very rural areas?
I actually don't know the answer to that question. I don't think so. I feel like I saw something else, Senator, that addressed those type of pit systems. I'm not sure if you know, Anthony, but I don't think this bill gets into those.
Those pit privies or whatever. They're closed systems. They're basically closed tanks, so they get pumped out by licensed septic haulers. So that's not really a concern for those. I think what the code does address, and most sanitary codes do too, is actually earthen privies, right, where there's just a hole in the ground with a shack above it, and those are not necessarily allowed.
Okay. So this legislation, if it's enacted, if we ramp up the number of evaluations that we get, and presumably there'll be an increase in the number of tanks being pumped, uh, will will there be waste disposition issues? If there's a larger waste stream of septic material, where does it go?
I think that is an issue. It is an issue that is not necessarily solved by this legislation, but it is a conversation our work group has been having with Eagle and others. We've been having concerns with the number of municipal wastewater treatment areas where you would take perhaps the septic to them. There have been communities that have been reducing the amount of septic systems that they allow in to their area. There's a lot of been concern about PFAS and other types of material that could be brought in. And so there is another issue that we have to, I think, resolve as a state on how we take a look at, the removal of that waste. Some communities have looked at how they build it on their own, but we have to figure that out, and that is an ongoing conversation we need to continue to have.
So, Anthony, question: is there a relationship between septic waste and PFAS? Is that a concern?
Yeah, that is a concern. We have PFAS in all sorts of consumer products and things that are part of our food system, paper plates, even wax paper and things used for cooking. So there's lots of ways that those can enter household and other commercial waste that then do get into septic systems. They're not designed to treat that. So there may be some incidental treatment, but for the most part, these forever chemicals travel pretty easily through our groundwater systems. And this, as I mentioned, this is not a solution to all of our water quality issues or even all of our human wastewater issues. We need to keep working, but in order to do that, we need a common starting point. We need a place for the state, for the legislature to be able to work from and continue to do the good work of preserving our Great Lakes.
So, but can we state, last question, can we state, Anthony, that with this legislation, we can look to improvements in our groundwater quality and surface water quality?
Yes. Yes, unequivocally, this will benefit as it ramps out, will benefit our water quality. The only challenge is that it will take a long time to inspect and find these failing systems, and then it will take time for all of the contamination we've already loaded into our system, into our groundwaters to move through. It will be generations before the damage of the last 40 years of inaction is fully cleared. And so again, we need to do it now. We need to move now.
And likely to improve public health or public health risk as well. Thank you, panelists. This was a great discussion. I wish we had more time. Liz, time for you to take over.
Wow, what a fantastic, outstanding panel. And I just want to express my gratitude to Skip and all of our fantastic panelists, Senator Singh, Dan and Anthony and Megan. The dimensions of and topics and of touching on the social, the public health, environmental, and economic impacts of this legislation is just been fantastic. We want to also extend appreciation and gratitude to all of you who've spent the last hour with us. I hope it's been as informative as I feel. Help us keep this conversation alive, contacting your elected leaders. And thank you again for joining us. Have a great afternoon.